Thank you for being here today. So I'm going to talk to you about athletic low back pain and return to sport. First and foremost, low back pain has been reported in 20 to 30% of the adolescent age group as well as older college athletes. 10 to 15% of sports injuries are low back pain. Most common causes of low back pain in athletes are muscular ligamentous strains and sprains. Close to 40% are spondylolysis, which are stress fractures of the pars, or spondylolisthesis, which is a slippage of the vertebrae over the one just below it in the adolescent population. Disc herniations occur between 3.2 and 11% in adolescents, much more prevalent in college athletes. This then leads to a degenerative disc disease, which will then lead to more back pain in the future. Here's your spine. To the left is your healthy spine. This is where your pars is. In the middle is where your spondy is. That's where your fracture happens. And to the right, that's if you have two fractures on both sides, the vertebrae starts to slide forward. Most commonly occurs at L5. The mechanical causes for spondies are repetitive axial loading and rotation, specifically in an extended lumbar spine, leading to fatigue fractures of the pars. Spondylolisthesis is a result of common complication of bilateral spondylitic lesions at the same level. Here's your picture of a disc herniation that's compressing a nerve. Mechanical causes of herniations result from acute trauma or collision sports, or compression forced during forward flexion. Most commonly affects L4, L5, and L5S1. Here's a list of sports with higher prevalence of back pain. Football, cheerleading, ballet, diving, gymnastics, weightlifting, and wrestling are at a higher risk for spondies. Gymnastics, weightlifting, and wrestling are at a higher risk for both. Risk factors. We have your intrinsic factors, which is basically your own things you cannot change, and extrinsic, things around you that can be changed. I'll discuss a few of them. Girls are at high risk for back pain. Previous injury or complaint of low back pain increases the risk. Playing certain positions, such as being a football lineman, increases your risk for back pain, including spondies. Young athletes participate in intense training programs with repetitive practice, which increase the likelihood of injury. It's most common to get hurt during preseason and during competitions. Other risk factors. Regional interdependence. RI is a concept that seemingly unrelated impairments in other regions of the body may contribute and be related to the patient's primary complaint. For example, hip strength and range of motion deficits. Nadler investigated the relationship between lower limb function and low back pain in college athletes. The study showed athletes with reported low back pain demonstrated a 5.8% greater difference between right and left hip extensor strength compared with athletes without low back pain. Similarly, Kim et al. Found that a loss of hip rotation in the lead leg correlates with increased reports of low back pain in professional golfers. R.A. Kaplan wrote up a case study about an 18-year-old athlete who presented with nonspecific low back pain. His exam findings showed a positive Thomas test on both sides, which means that his hip flexors were tight. Right was worse than left, excessive hip abduction and external rotation, and lumbar spine deficits. The program consisted of direct treatment at the spine, as well as improving anterior mobility of the hips. He improved after two months. According to Kai, in the article, Low Back and Lower Limb Muscle Performance in Male and Female Recreational Runners with Low Back Pain, the study looked at runners between ages of 21 and 45 and identified the runners with chronic low back pain exhibited de-extensor torque. In addition, male runners had a decrease in lumbar multifida activation. One other risk factor we have to address is posture. Prolonged incorrect positioning will overstretch the paraspinal muscles and ligaments, compress the disc, and predispose the spine to injury. Whether you're a 16-year-old high school student who plays football, a 25-year-old medical student who plays basketball between shifts, or a 47-year-old investment banker by day who's a weekend warrior tennis player on the weekends, if you slouch, you're going to have back pain. Treatment. All research in regards to athletic low back pain focuses on addressing flexibility deficits, incorporating dynamic stabilization training to increase core, and addressing other impairments along the way. Here's some exercises that are in the literature that help address core strengthening. Planks, side planks, bridges, single leg bridges, quadruped work, which is great at addressing multifoot eye weakness, kneeling chops. These are great because they knock out the hip flexor and really recruit your transverse abdominis muscle. Single leg Romanian deadlifts. I tell my patients these are all great, but I also tell them in your everyday life, keep your core engaged. That's how you truly get a strong core. Walking, talking, doing laundry, lifting your kids. Keep your core engaged and you have a strong core. Some specifics for treatment. For spondies, you want to avoid hyperextension because it's going to stress the spine more. You want to maintain a neutral spine with everything you do. Disc herniations, you want to avoid flexion, you want to avoid slouching. You also want to really perform extension-based movements to help reduce that disc. Furthermore, here's some stretches. Hamstring, ITB, piriformis, kneeling hip flexor stretch. If you do have back pain, you do try these, and your pain continues for 7 or 10 days without improvement, please consult your physician. All the things I just talked about can also be used as injury prevention program. What do the experts say when returning to sport? 92% of young athletes return back to sport after conservative management of spondies. At least 4 to 6 weeks are necessary of rest, followed by physical therapy. They tend to return back to sport 2 to 6 months after. Close to 80% of athletes with disc herniations return to play after 4.5 months of conservative management. Most experts believe that athletes should wait until there's complete or nearly complete relief of symptoms, achievement of more than 80% strength, and full range of motion of the spine. But we can also do some functional tests. They should be sport-specific, qualitative as well as quantitative. We can measure them and we can also look at the quality of movement. Monsky and Ryman discussed 4 tests that can be applied to the core. Trunk and power test, sidearm medicine ball throw, vertical jump, and broad jump. I have videos for all, and hopefully they work. Here's the trunk power test.
Trunk power test. 1, 2, 3.
Five or 6 trials are necessary before testing. Right to left distance should be no greater than 10 to 15%. Just as guidance, 40 intercollegiate football players were able to throw 34 feet, but these are 7-kilogram medicine balls. So all the studies use different balls, but usually everything fell between 30 and 35 feet. The sidearm medicine ball.
Sidearm medicine ball. Patient starts a slightly flexed position with the ball at his knees. He turns all the way through, extends his body, and releases the ball to the other side over his shoulder.
It's another functional test of the trunk power, measuring right and left distance. Right and left distance should not be greater than 10 to 15%. In tennis players, they looked at this study, and these are 2.7 kilogram ball, and males threw about 36 feet. Vertical jump.
1, 2, 3.
Scores the distance between the first reach and the second. Normal scores for high school athletes should be between 16 and 20 inches. The last one, the broad jump. The broad jump was actually an Olympic event until 1912.
1, 2, 3.
For males, 16 over, including adults, I like to see somebody who's jumping above 6.5 feet. For females across the board, it should be 4 feet and 9 inches. Some other screens. The FMS looks at 7 different movement patterns and helps identify musculoskeletal deficiencies. Movements for the core include overhead squat, inline lunge, hurdle step, trunk stability push-up, and core rotational stability. Improper form, inability to perform these are indicative of deficits in fundamental movement patterns. They should be addressed. So in conclusion, the combination of pain-free movement, 80% return of strength, symmetrical movement patterns, and good functional scores will determine when an athlete is ready to go back to sports.